Thank you very much, Elaine, and good morning or good afternoon, ladies. I'd like to start by acknowledging the traditional owners of the land on which we are meeting, the Wurundjeri people of the Kulin Nation. It's, as Elaine said, I was recently appointed as a board member to the Burnet Institute, and so it's a great pleasure for me to be here at this lunch today addressing you. And as I think Heidi said, I can't remember if it was Heidi or Elaine said at the beginning, the International Women's Day theme for this year is Planet 50-50 by 2030. That's a bit complex. Planet 50-50 by 2030, stepping it up for gender equity. So I thought that it was probably appropriate today to start with a few global statistics, and I know statistics can bore, but I think it's good to frame it of where we actually are in 2016 in terms of global equality for women. And I'm going to focus on women and health because, of course, Burnet's mission, as Heidi did say, is to achieve better health for poor and vulnerable communities through research, education and public health. But also, and fundamentally, and Lady Carol and I have just been talking about this, health and education are fundamental underpinnings of any sustainable improvement in the status of women. We're not going to make the improvements we need to make unless health and education are progressed together. After giving you some statistics, I want to share with you a few stories, just a few, about some of the remarkable women in health from all walks of life that I've been privileged to meet over the last several decades. And then finally, I'm going to focus specifically on malaria and its impact on women and show a short video. And then I'm going to hand over to some of the remarkable women who work here in the Burnet and who actually know a hell of a lot more about malaria than I do. So I'm looking forward to them talking to you about malaria. So women actually roughly make up half the world population, which is a good start for equality. But while there's been a dramatic decrease in the number of people living in extreme poverty over the last 15 years, with the flow-on effects to health, because it does lift all rising tides, or whatever the phrase is, there has been a general improvement of health for many people, which is fantastic news. A majority of those people living in extreme poverty are women, so they're still at the bottom of the heap. Maternal mortality has fallen by 47% since 1990, and this is hugely significant not only for individual women, but also the implications for their families and communities. So just a few statistics. Infants are 10 times more likely to die if their mothers died. And children in households where female caregivers have died, and that could be a grandmother or a mother, have less access to food and clothing and spend half as much time in school than those in households where the adult males die. I mean, it really makes a huge difference. And the death of a mother particularly disadvantages girls because they're much more likely to be pulled out of school to take on the caretaker role. So there has been measurable increases in maternal mortality, which is great, but there's still a way to go. There's been measurable increases in the number of girls enrolled in or having attended school, and this is one of my big themes. How does this relate to health? Well, health and education, particularly for women, go hand in hand. And data, for instance, from Africa shows clearly that for every additional year a girl stays in school, it reduces her risk of HIV/AIDS infection. There's now quite substantial documentation across a number of countries in Africa. Now, you also would need to take into account the fact that the girls that stay in secondary school probably also coming from better socioeconomic areas, but it still has a noticeable impact on their HIV infection. And it also reduces the chances of her being a child bride, which also has a lot of flow-on effects. Another progress is access to family planning in developing countries since the program began in the 1960s, and that's been a tremendous success, particularly in some countries, in providing access to modern methods of contraception. One report that I read, it said in 2012 was estimated that 118 million unintended pregnancies had been avoided through the use of contraception. So I always think it's very important to celebrate success. I think that we all need to feel and know that what we're doing is making a difference. It doesn't matter where we are, we need to feel that what we're doing is making positive progress. But we also need to be very clear-eyed about what the huge challenges are. So what are some of the key challenges in health if we're going to get to gender equality by 2030? So I said the maternal mortality has dropped by 47%, But at the same time, cervical cancer death rates have increased by 39%, and in fact threaten to wipe out the gains made in saving women's lives in childbirth. There is a graph, which I'm not going to show today, which is really horrifying. You've got maternal mortality falling like this, and you've got deaths from cervical cancer increasing like that. And a woman's chance of contracting and surviving cervical cancer is strongly correlated with where they live. So more than 85% of the deaths from cervical cancer around the world are in developing countries. And this is despite the fact that we have a very effective vaccine against the human papillomavirus, which is responsible for a majority of cervical cancer. But this vaccine is largely not available to women in the poorest countries. There are also very effective methods for early screening and treatment, which have proven very successful in high-income countries. And if you look at the drop in cervical cancer in countries like Australia, they're very significant, but they're largely not available to poorer countries. Another example, the largest single cause of maternal mortality is postpartum hemorrhaging, which can be significantly reduced if there's immediate access to oxytocin, which contracts the uterus and helps to stop the bleeding. But for example, in PNG, where 57% of births are unsupervised, this simple solution is most often not available to women. So why is this the case? Competing health priorities, insufficient resources, very weak health systems, and limited number of trained providers all contribute to these poor rates. And then finally, I want to talk about, but by no means least, is gender-based violence that's fueling the HIV epidemic in Africa, where young women are twice as likely as young men to be HIV infected, and in some countries, they're 5 times more likely to be infected. And it's also the single biggest factor driving HIV infections amongst women and girls in Papua New Guinea. I hope that from these examples I've given you, it's clear that achieving gender equality in health isn't only about medical treatment and technological solutions, although they're absolutely critical and have made a huge difference, but it's also about addressing cultural and social issues at the same time. And this is why the strong voice of women at all levels of society and internationally is really essential. So great to see all these strong women in the room today. And it's one of the reasons that I'm so pleased to be on the Burnet Institute's board, because I think the Burnet's model of generating new knowledge and health intervention tools and then partnering in country with local service providers to apply the best available evidence about what works is absolutely the way to make a difference. So I'm really delighted to be part of the Burnet. So let me just give you a few statistics can dehumanize. So let me give you a few examples of the remarkable women I've met over the last couple of decades. I've worked for the last 10 years, as Elaine said, in 2 of what I think are the most exciting and innovative public-private partnerships in global health. And in those roles, I visited many developing countries and saw firsthand both how limited and basic many of the health services are and the consequences for women and children when they can't access the support they need, and the absolute devastation and anguish as their health, mother's health, deteriorates and or they watch their children die of diseases or health conditions that are preventable and treatable. It's appalling. I've also had the opportunity to meet and talk with the most extraordinary women from all walks of life. I've talked to women who've lost children to pneumonia or diarrhoea and who were determined to do everything they could to access the vaccines which would protect subsequent children. Women who are HIV positive and engaging in peer support. Women health workers who walk long distances to catch the local bus to collect the medication and supplies for their tiny village outposts. No vehicles for them. They carry it all, catch the local bus and carry it all. And women health workers who walk long distances in the hot sun, carrying their heavy vaccine fridge bags over their shoulders just to make sure that children in remote villages have access to vaccines. And I've also talked to First Ladies and women presidents who advocate passionately and courageously, in many cases, about the conditions of women in their country, about the need for health services that we take for granted here. And we complain a lot about the health services here, but I tell you what, if you looked at some of the health services in the countries I've been in, you would think we are in luxury. And about gender-based violence and the need for governments and communities and individuals to get involved. So let me just start with the story of Zina in Tanzania, but her story tragically is very similar to the experience of many women in lower income countries. Zina was first misdiagnosed with a sexually transmitted infection, and then 18 months later she was told that actually she had very advanced stage cervical cancer. She was a widow with 4 children living in a remote town in Tanzania, and she had to sell her mattress to pay for the bus fare to travel 1,000 miles to Dar es Salaam to the cancer hospital. Her prognosis when I met her was very poor, but she was still holding on to the hope that she would be able to go back to her children in the village where she lived. And Zina told me her story and said she wanted me to use it because she wanted people to know about these situations, and if it could be used to try and achieve change for other women, including access to the HPV vaccine, to protect the next generation of young women, and the availability of early diagnosis and treatment, then she was happy for it to be used. A second vivid memory I have is a meeting with a group of women from rural villages in Rwanda. These women had formed an HIV-positive rural women's support network with funds from the Global Fund. They wanted to tell me what they were doing and how much they appreciated the support that the fund had given them and what difference it made to their lives. These were women who in many cases were HIV positive as a result of rape during the genocide, or who contracted HIV from their husbands, who in some cases had actually then thrown them out because they felt it was their wife to blame for the infection. These women were just remarkably positive and supportive of each other, but more than that, they were proactively encouraging women in their villages to be tested and counselling them if they were positive. And they were also encouraging and supporting them to tell their husbands, which was a huge step for many of them, and for the husbands to be tested. And I can tell you, it's a very humbling experience for someone who brought up her children in safe and secure Canberra to hear the stories of these women. And I wonder whether I would really have the strength, the resilience, or the good humour to keep doing what they did on a day-to-day basis. And the last story I want to tell you is right at the other end of the spectrum. It's about the former First Lady of Zambia, Dr. Christine Kasaba-Satar, who is a practicing gynaecologist and gave a plenary session at the World Health Assembly in 2014 on gender violence, gender-based violence. She's a tall, very statuesque woman, and she spoke with enormous eloquence and passion about what she called indisputably the most widespread and pervasive of all human rights violations throughout the world. And she used graphic and shocking examples of the mutilations she had had to deal with as a doctor following attacks on women. She then looked out into the theatre, which seemed to me to be significantly full of grey-suited men, many of them ministers of health from Africa and their senior staff, and she said, "Speaking as an African, and sadly, we live in a society where there's quiet acceptance and tolerance of the subjugation of women, and I am angered by the impunity with which these acts are perpetrated under the guise of culture." This is the sort of political leadership in countries where violence against women is pervasive that will ultimately make a difference. And needless to say, the room was absolutely electric when she finished speaking. So finally to malaria. We chose to focus specifically on malaria because it's an area where the Burnet has a lot of expertise on both the research side and the programs that it runs in country, and because it disproportionately impacts on pregnant women and their children. In Australia, we haven't had a case of endemic or locally transmitted malaria since the mid-1980s, as far as I can establish. So many Australians have never really experienced or seen anyone with malaria unless they've worked in countries or travelled in countries where there's endemic malaria. But in countries where the malaria rates are high, it poses a very substantial threat to the lives of both pregnant women, their unborn and their newborn children. The rate of malaria infection is higher in pregnant women because of their decreased immunity and therefore greater susceptibility to malaria infection. As I said, I'm not a medical doctor and I'm not an immunologist, so I have a certain amount of reluctance speaking about these topics when there are experts in the room, but you'll get a chance to hear from them. But in fact, the risk of infection is 50% higher for pregnant women compared to non-pregnant women. And the prevalence of malaria in pregnancy is much higher in young women, aged 15 to 19 years. and it decreases with subsequent pregnancies. But also pregnant women with malaria have an increased risk of abortion, of stillbirths, of premature delivery, and of low-weight babies. And women who are unfortunate to have dual HIV and malaria infections are particularly at risk of severe anemia and adverse birth outcomes. As is the case for most marginalised groups, the burden of disease due to malaria rests disproportionately on poor women and their children, who often also have limited education and are not aware of the possible consequences of malaria or how to protect themselves and their children from malaria. And this is tragic because it is largely preventable and it's treatable. But women do often face disproportionate barriers to access diagnostic and curative services, particularly when in some countries in this region, more than 60% of care is provided in the private sector. And so to be able to access that care requires money, the time, and the freedom to travel and seek care. The good news, you've got to match it with good news. The good news is that since the year 2000, globally, there's been a significant reduction in death rates from malaria. And in the Asia-Pacific region, the rates dropped 40% since the year 2000. And progress has been made in both small and large countries. So Sri Lanka, for instance, hasn't seen a case of malaria for 3 years. And even in China, it's making rapid progress towards elimination of malaria. And this progress is largely due to a massively increased effort, which has involved a combination of wide distribution of insecticide-impregnated bed nets, which not only protect people when they're asleep, but they also actually can kill mosquitoes who come in contact with them. So that's a big technological move, combined with something very practical, making bed nets available and making sure people sleep under them. That's the other thing. I've actually seen bed nets hung where there's a gap like this, and you think, well, that's not going to be very effective. The second effort is around eliminating breeding sites for mosquitoes, which includes the use of indoor spraying. And thirdly, community education at the local level and much easier access to immediate effective medication that has to happen very immediately once it's diagnosed. And I'm sure people will talk further about LAMP and the quick diagnosis we can do. Unfortunately, sorry to match it with this and that, but unfortunately we now also have the spread of multi-drug resistant malaria, which is currently largely concentrated in the greater Mekong sub-region. So that's the countries of Cambodia, Laos PDR, Myanmar, Thailand and Vietnam. And this actually could undermine a decade of extraordinary progress against the disease that disproportionately impacts on women and children. So we do have a bit of a looming emergency in our region. And I would like to think that a lesson from Ebola surely is that we need to respond swiftly and effectively early on to ensure that this doesn't get out of hand. I'm now actually out of order with my pages, so I've lost my last page. That's all right. However, in this region, there is a lot of confidence that we can make a difference, so much confidence, in fact, that led by the Australian government, there's been a leaders' declaration signed late last year for the 18 countries in the region to actually aim for elimination of malaria by 2030. So we need to ensure that not only is this declaration made by the leaders of country in this region, but that in fact it has substance under it, that it has resourcing, that it has political leadership, and that it actually makes a difference, a measurable difference. So it is possible that you can make a difference. So this is a great and achievable ambition, and we need to ensure that this declaration will deliver. The Burnet's doing some very important and groundbreaking research and programs in malaria, and all of that will contribute to this goal of elimination of malaria in the region, including, and we may hear about this today, including containing this multi-drug resistant malaria. But I'll let the experts talk about that. And now I'm going to hand back to Elaine and the research.